Welcome to Doctor to Patients. I'm Dr. Carrasco, your host. Today we're talking about a topic of anesthesia. You know, anesthesia is such an important part of our lives. If you've had surgery or you'll have surgery, you'll have to go through anesthesia. Now, what are the reasons to have anesthesia? Why do we even need it? Well, one, we have to have sedation. You have to be comfortable. You have to be sleepy and relaxed. You have to have amnesia. Amnesia is your inability to remember. Yes, let's be honest, we've heard something in the last year or so and throughout the years about people who remember or hear things during surgery because of the anesthesia. Even though it may be that that does occur, I think it's extremely rare, and there's no reason for you to be concerned about that. Our biggest concern is the fact that you go through anesthesia and that you learn today on our show kind of what anesthesia is and how it's done. We'll actually go through an area we talk about med school, where we kind of teach you what's going to happen. We're going to do an interview with a nice anesthesiologist, Dr. Armand Rodriguez, who'll kind of get an insight into what he thinks and how we decide what kind of anesthesia to give you. We'll also do an actual live intubation and an anesthetic. We'll actually put one of our nice patients that was going to have a surgery for replacement of a morphine pump, which has come up at a later show. But as he was preparing to have surgery, he agreed to let us film the anesthesia, and we're going to share that with you. It's really something unique and interesting, and I think you'll learn a lot from it. So today our topic is going to be anesthesia. Why do we need it? What's important about anesthesia? What do you need to do to prepare? Our job is to kind of help you understand medicine and the experience of medicine. The most important thing is to be ready for anesthesia. If you're very young and healthy, there's probably nothing to be done other than talk to your surgeon, an anesthesiologist, before the surgery. If you're in the 40s or 50s, let's say 40 years of age, you probably want a chest x-ray, you probably want an EKG, to kind of make sure that your baseline blood, heart, lungs are doing okay. The most important word here is optimization. We want to make sure that when you go to surgery and you go for anesthesia, that you're at your best shape possible. Also today we're going to talk about the question of the day. And it's generally going to be a question that has to do with something that occurs on our show. So our question of the day is, how many vocal cords do we have? Is the answer 2, 3, or 4? We'll answer that question sometime during our show. We also want to encourage you to go to drtopatients.com. Send us your response. What's important is that this show is your show. We want to share information with you. We want you to give us some feedback. And now we're going to see an interview with Dr. Armand Rodriguez when he discusses anesthesia.